My applied research study is called Academic and Social Equity for Students with Autism in College, a Mixed Methods Study. My problem of practice involves students on the autism spectrum who continue to face lower college completion rates, with about 40% who complete a college degree within 6 years versus 60% of their neurotypical peers. These students are most likely to fail courses and report higher levels of social isolation, anxiety, and depression, which all impact academic engagement and retention. These disparities are driven by systemic issues like limited autism-specific faculty training, following a reactive disability services response model, and fragmented supports that do not fully address academic, social, and sensory needs. Without systemic change, students with autism will continue to be underserved in post-secondary education. For my literature review, I have 3 topics, with the first titled Barriers to Post-Secondary Success for Students with Autism Spectrum Disorder, Academic, Social, and Institutional Factors. The literature identifies academic, social, and institutional challenges as key barriers for students with autism in college. Academically, students with autism often struggle with executive functioning, including time management, task initiation, and adapting to traditional teaching methods. Socially, navigating relationships, group work, and campus life can also be challenging and isolating. Institutionally, many colleges rely on a reactive disability model where students must disclose their diagnosis and advocate for themselves. The absence of policies and tailored support for the unique needs of students with autism further increases the gap in access and success for this growing college student population. My second literature review topic is the effectiveness of support services and accommodations for students with autism in higher education. While many colleges offer accommodations like extended testing time and note-taking support, these often fall short of addressing social and executive functioning needs. Autism support programs, or ASPs, have shown promising results, offering academic coaching, peer mentorship, social skills training, and transition support. However, these programs are often rare and not widely available. There is also a lack of coordination across campus departments, forcing students to navigate multiple offices, causing confusion, stress, and leaving students with autism feeling very overwhelmed. My third literature review topic is faculty awareness and inclusive teaching practices supporting students on the spectrum in higher education. Faculty play a critical role in shaping the student experience, yet many report having limited training in autism awareness and neurodiversity. Misunderstood behaviors, such as avoiding eye contact or remaining quiet when called upon, are sometimes seen as a form of disengagement, when in reality, they are common traits of students with autism. Inclusive teaching practices such as clear course structures and the use of universal design for learning can benefit all students, including those with autism. Research shows that faculty training in neurodiversity leads to improved academic performance and lower stress for these students. As part of my methodology for this study, I will be conducting the study at Cal State University, Fullerton, using a convergent parallel mixed methods design, simultaneously collecting both quantitative and qualitative data. The goal is to measure the extent of the challenges students are facing, but also to hear directly from students, faculty, and staff about their lived experiences and perspectives. This approach allows for a more comprehensive understanding of both the data and the personal experiences behind them, and it helps uncover the deeper why behind the academic and social outcome gaps for students with autism. At Cal State University Fullerton, when collecting the quantitative data, I will distribute an anonymous online survey for students who have been formally diagnosed with autism, using a representative sample of students. The survey will be fully accessible and secure and will collect data on grade point averages, course withdrawal rates, levels of accommodation usage, and perceptions of available student support. For the qualitative data, I will conduct semi-structured interviews and focus groups with students, faculty, and staff. These interviews will take place online or in person and will be recorded with participant consent. The aim is to understand lived experiences, perceptions of support, and any barriers or successes participants have encountered. All data will be kept confidential and will follow ethical standards, especially around disability disclosure and privacy. Quantitative survey data will be analyzed using inferential statistics, including t-tests to compare academic performance between students who use accommodations versus those who don't, chi-score tests to explore relationships between service use, satisfaction with faculty support, and feelings of belonging, and a correlational analysis to examine links between perceptions of faculty understanding and academic success. For the qualitative data, I will use thematic analysis, transcribing each interview, coding the responses, and identifying patterns or recurring themes. Codes will be grouped into categories such as faculty understanding of autism, student service access barriers, campus support program effectiveness, and misconceptions of students with autism as some of the options. This is the first slide of 2 slides showing my references used in this study and presentation and overall assignment. And here is the last slide with the remainder of my references, again used for this assignment, reference in this presentation, and for the overall case study.